Okay, so that's good. And then, all right, so we're gonna go ahead and, hi Carol, I see you. I'm gonna go ahead and mute everybody. And I'm gonna go ahead and start so that as people come in, hopefully, current and new participants will be muted. Okay. Okay, so I wanted to start out first of all in showing people how to get the information that I'm going to be going over. Many of you got a constant contact with several links on it, and there are some links, for instance, that I'll go to these practice questions because that's where I'm going to put all of the links that will be helpful in this presentation, but also for other presentations. And it will be in the answers here. When we go down to MegaGuard. MegaGuard. Okay. So all of the links that I put in, see, are no longer there. Okay. So I will show you, you have links at the bottom of most of the emails that I send. And I'm going to put those links back in so that you can see what I'm talking about. All right, do this really quick. Because there is a client folder that is on many of the emails, but many people do not know that it exists. And I'm not sure why my links didn't stay, but I will show you. Client education folder is here, and everyone has access to this. So when you go into the marketing materials, you'll see that all of the products are there, and the MegaGuard is here. And so, for instance, we take this brochure, which is on the MegaGuard, and I'm going to put that link back on this. This should be a, this Google Docs should be accessible to everyone. So I'm not sure why the links disappeared that I was adding here. Because I had it here. Oh, here they are. Oh, they are here. Now they're back. So this client education is on the Microbiome University. So when you click that, it opens up to all of the products. And then you're able to go into all the research or all the marketing brochures. And I showed you the marketing brochure, but when you go into the research on MegaGuard, on the product is here. So I put those links here in the Microbiome University, as well as the slides that we're going to go over today. And then also on each one of these, where there is a specific point that's made, I've tried to reference that individual white paper. And then if there's other things that I'll be researching as well to have a reference for you on this one location. What you're going to get today is what I know about this product. Many of you know the product was just launched. I have yet to receive my own bottle. So what you're going to get is more of the theory of what we know about it and what we've heard. We do have one of our reps that is pregnant, and she started taking it for the nausea, and she said it's working wonderfully. So we're going to be getting a lot more feedback. Yesterday was probably when most people have put in their first order. So this feedback will be coming, I would say, you know, next week, the week following. But it's important before you get the product that you know how to position it, how to talk about it with patients, with clients, and know what research is behind it. So I'm going to start off with the PowerPoint and see view present. Okay, let's start at the beginning. Okay, so MegaGuard is designed to protect the stomach. And the whole point is Microbiome Labs wants to do everything that is affecting the microbiome from the beginning of the GI tract to the end. So this is going to be a very important part because so many people were asking us what prokinetics, what motility, what H.pylori product, what dyspepsia product do we recommend? And there were so many on the market, and we really needed one that had all of the things we thought were important together. So that is what we're providing here. So what you're going to see is the patented product here, GutGuard, is very well established. You'll see all the references on that. That is the licorice flavonoid component. The artichoke leaf is based on a German study, which is a drug, and the ginger extract is based on an Italian study, which is a drug. So, you know, these are very well established products, and they're at the clinical dose that is necessary that matches the study or the drug. And you'll find that that's not always the case out in the market. So we're recommending this product for indigestion, GERD, dyspepsia, ulcers, and H.pylori, and nausea. Dyspepsia is a functional disorder of the upper intestinal tract, involves the bile, liver, pancreas, and affects 30% of the population. So again, in the GutGuard, this is the registered trademark product. The product is, the licorice is sourced from India. It's at 75 milligrams. It's to be given BID. It's different from deglycerinized licorice, which the glycyrrhizin component can increase blood pressure and reduce serum potassium levels, but it probably won't, because it really is at such a low level in this product that I would be surprised if it did. Only if someone were to overdose would it be able to do that, because the concentrated flavonoids are the key ingredient in this product. Here it's grouping the studies that have been are made available on this product, from clinical studies, preclinical studies, and compatibility studies. So when people ask, can we take the MegaGuard with probiotics? Can we take it with digestive enzymes? Can we take it with bile salts? The answer is yes. This is extremely important, and that is the study on how the GutGuard component, the licorice component, helps with H.pylori. And the mechanism of action, there are actually several. The primary one is it inhibits the protein synthesis of the organism. So we have this available, you can reference it, again, very well established. So the key points on the licorice is that it acts as a gastroprotective agent, and as a prokinetic agent. And the mechanism behind those is primarily that it's changing the pH. And that's part of the mechanism. It helps with the H.pylori as well, that the H.pylori is not able to attach at certain pHs. And then the additional inhibition of the protein synthesis of the H.pylori. Then the second component of the product is artichoke extract. This artichoke is sourced from Spain. Very good studies on how it helps with dyspepsia and digestive issues. The primary mechanism of this product is to stimulate bile flow. So you're going to get the question, can someone use it who does not have a gallbladder? Absolutely, because they still need to stimulate the flow of bile, and even more so when they don't have a gallbladder that's regulating the bile. So you can recommend this for those with heartburn, indigestion, vomiting, gas, fat intolerance, irregular bowel movements, and stomach pain. So it's going to help with motility, which is extremely important when you're dealing with SIBO. The primary problem, what's causing SIBO or making it worse, is the fact that the bowels are not moving. And again, this is based on a German study. So in the product, it has the exact amount that was in this product from the study that is actually a drug in Europe or in Germany. There are no contraindications or drug interactions. Here we're talking about the cholinergic effect of it. So it's going to help with cholesterol because, again, it's dealing with the emulsification of fats in the body, and that's why it's helping, you know, with the bile in the gallbladder and helping to stimulate the bile. The third component is the ginger extract. This is sourced from India. Most other gingers on the market have only 5% of the gingerols. That would be something like a ginger beer. And you look at ours, which is 25 to 30, there's going to be a huge difference. Very well established as an anti-inflammatory. So it'll help with the pancreas. You know, we're not promoting it as anti-cancer, but because of its anti-inflammatory in all of the studies out there, that's just a fact about ginger. Many may support the increased gastric emptying and GI transit. This is, again, well established. Why it helps with nausea and helps with transit time and motility. Again, based on an Italian study that is a drug in Italy. And that study showed that it reduces symptoms of dyspepsia in 14 days. So we've got, again, the product formula is licorice, artichoke, and ginger. We're looking to recommend it for those with H.pylori, functional dyspepsia, indigestion, stomach ulcers, digestive discomforts. Will be marketed, well, it is being marketed as an herbal digestive aid, and it's to be taken 1 capsule with lunch and 1 with dinner. And this is a product that you can take continually, especially someone who doesn't have a gallbladder, and they're going to need some bile stimulation. And if they have been on proton pump inhibitors, I think many of us realize that that is causing issues with the GI tract, and you know, the symptoms are the reason they're taking those drugs, but you know, it's a vicious cycle. So they're of course going to ask you, how do they transition from one to the other? Definitely tell them, do not cold turkey their pharmaceutical drug. Officially, you have to tell them to go back to their physician. What I've always said in the past, that if it were me, you know, I would ramp down on one while I'm ramping up on the other, just to be on the safe side. So that I did have one client who did not tell me she was on Nexium. She was actually on like 4 or 5, and she stopped cold turkey and got projectile vomiting. So, you know, those things can happen. So you have to, you know, not even assume that they've told you all the medications they're on. Just, you know, always remind people, don't ever cold turkey any pharmaceutical drugs. So I'm going to go ahead and take everyone off of mute so that we can have some questions. I see how to unmute. Okay, I guess I have to unmute individually each one. Okay. Okay.
Hi, Tracy.
Live again. Hi there. Okay. I guess some people who, maybe you can override my unmuting you, but anyway, just check your mute if you think I'm not hearing. I heard someone say hi. Is that Carol? Nope. Who said hi? Because I can't see everyone's face. Do you want to go ahead and turn your videos on so I can see who's talking? I don't want to surprise anybody if you're in your house coat. So, okay, so there's some chat. I have a lot of background noise. Okay, so she's going to stay muted. Got that? Got it. Super. So I've got the chat on. So if you want to go ahead and type out a question, go ahead. Okay, somebody trying to talk? So last week was a mess. I apologize to anyone that, go ahead.
Tracy, this is Eva Clark. I have a question. How safe is this product with someone with active gastritis?
It's going to be safe. Again, this is an herbal extract. Certainly, I would hope that you're already looking at this person as far as using the total gut restoration. Have they already started with Megaspore?
Yes.
Okay. Yes. Super. Because, you know, when I'm asked, where does this product fall in the whole gut restoration program? If someone has a lot of dyspepsia, a lot of GERD, you know, that's an acute symptom that they need to deal with that right now. So it's okay to start this product immediately. Even, you know, if you've started the Megaspore, great, just add this product right onto it. If you don't have the Megaspore, but it's on order, go ahead and get them started on this product. If they've been on Megaspore and are starting on the total gut restoration, go ahead and add this to it. So you just want to deal with an acute symptom because that's going to help them be better compliant. That's something that they're dealing with at every meal. So, and it's okay to take this product, you know, at every meal, if that's when they're having the product. That's when they're having the symptom.
Mm-hmm. Okay, thank you, Tracy.
It's going to take.
Sorry,
Sure.
I have one more question. I have a 3-year-old client that is dealing with a lot of different issues. She's on, I think, 7 foods only. Pandas, mast cells, a very, very histamine problem, and a lot of different things that viral. And the big issue with this child is that this child has SIBO, this child has H.pylori. They have an issue with connective tissue, so her sphincter is not closing. And the mom is desperate. So I don't know if small doses of this product would be helpful. She's using Mega.
Is she on? Yes, that was my question. Is she on the Total Gut Restoration Program?
I just met this client in last week. So she's been working with different practitioners, so I'm not sure, but she is using Megaspore for sure. So I don't know what she did in past. So I'm just asking for future because she's having a flare up right at this moment. And she was just saying the child is having difficulties. So I was just, that was in my, one of the questions because I will contact the mom to see if she can use this product with this child.
Yes, and everything that you described, this child is having an immune dysfunction. All of those are related to the immune system, which is the headquarters of the immune system is in the gut. And yes, this product will help with that motility because you've got to keep transit time. You've got to keep all of that lipopolysaccharide that's being shed from the cell wall of the gram-negative bacteria that is, causing the leaky gut, is causing the shutdown of the bowels and causing the irritation. You've got to keep moving it out. Right. So that's going to be huge in the prokinetics of MegaGuard. So you're helping with those acute symptoms. At the same time, you're building back her immune system. You're reconditioning the gut. And the SIBO, you know, a biggest part of it is the motility, but also, you know, the gut is broken down into different areas of pH, and the organisms know where they're supposed to live by their zip code, which is based on pH.
Right.
So those barriers have to be reestablished. And for the you know, intestinal part of it, that's what MegaSpore does. For the gastric part of it, that's what MegaGuard is going to do, so that we can reestablish the proper condition for each segment of the GI from the mouth to the anus. Okay.
Thank you. So what would be a recommended dose for a 3-year-old child? She's small for her age. So, and can you open the capsule?
No, not on the MegaGuard, because it's going to taste horrendous.
Okay.
So, you know, will she take a capsule at all?
I don't know yet. That's one of the questions that I have to ask when I'm going to have more information from the mom.
Okay. Yeah, because all of the gut restoration products, MegaSpore can be opened up, the IgG 2000 can be opened up, the prebiotic and the megamucosa are powder. So those are easy to dose by weight. And most children can easily do a half a capsule of MegaSpore every other day to get started. And, you know, and then, you know, work it up to a whole capsule, and then a fourth to a half a scoop of the powders. And then the IgG can even be added if you know, the megamucosa isn't tolerated well. So you can work around a lot of the children's doses with that. With this one, it's going to be a little trickier. There are some tricks about how to get capsules down. And if you haven't used them before, sometimes just wetting with the saliva, wetting the capsule will slide down the esophagus better. Another trick is, you know, people think that they should put their head back when they take a capsule, and that's absolutely the wrong thing to do. That actually, if you lean over and you have a mouth of water, the capsule will float up, and then it's easier to swallow. So sometimes a little bit of coaching on how to take capsules will help a great deal for especially children.
Okay. All right, Tracy, thank you.
You're welcome. And hey, that reminded me too, there were some questions, and this might stimulate some more questions on the Microbiome University. For instance, okay, when to introduce into total gut restoration program. And I think I answered that just in the beginning is fine. When they're having acute symptoms is fine. It's not, it should be well tolerated. I always recommend whatever you're adding, always add it one at a time. So if you have multiple products, titrate each one and add them one at a time. So if there's any intolerance, you know exactly which product and at what dose was giving them a problem. What proof is this formula based on? It's the registered trademark Licorice, the German pharmaceutical Artichoke, and the Italian pharmaceutical Ginger. So that's what it's based on. What ingredient is good for the stomach? That would be primarily the Licorice. What ingredient is good for the gallbladder? That's primarily the Artichoke. Which ingredient supports the intestinal motility? That's primarily the Ginger. What is the mechanism of action for increasing gastric emptying and motility? And that's the change of the pH. What is the mechanism of action for balancing H.pylori? And that is the reduction of protein synthesis of the organism. And what is the proper time to take the capsules? That's at lunch and dinner, 2 a day. If you don't have a gallbladder and you need to increase that bile stimulation, you would take it before the meal. If you need it to help with nausea after eating, then you would take it after the meal. Why should H.pylori be balanced instead of eradicated? Now, this is very controversial, and I've kind of gone around and around with some of my GI friends, my gastroenterology docs about this, because there's a lot more evidence now that H. pylori is part of the normal microbiome at certain levels. No, it's not supposed to, come out of, ratio as far as overpopulate and cause ulcers and all the other things, but it's a symptom. It's a symptom of the dysbiosis, of the change in the gut environment. So once we change all of those, it will come back into balance. And then supporting blank decreases SIBO, supporting motility. That's the key. And of course, reconditioning the gut to bring back the pH zip codes, I like to call them. And then all those answers, of course, are on this other tab that I just went over. Now, this Microbiome University is meant to be a working page. If you find evidence to the contrary on any of this, if you find documents, white papers, links that support any of this, you are welcome to add it, because I would hope that my goal is to have the most educated, highest level competence in practitioners in the country. So I'm in charge of Texas and Idaho, and to me, education is the key. So the more brains we can bring together on this, the better. Okay, so I'll shut up now. More questions from those attending.
Hey Tracy, this is Lynette. I just have a general question about SIBO. This past weekend, I ate a whole bunch of fruit, and I noticed that my stomach was like extremely extended or distended. And I was wondering, is that a symptom of SIBO?
It could be. Fruit has sugar. Sugar feeds yeast. And yeast, it's kind of like a fermentation that will bloat you. So I would be more inclined to think that was a reaction of having yeast. SIBO, yes, it does involve bloating, but it's going to be all the time. I mean, you've got all the dyspepsia, all of the gas and bloating, and it's going to be after a meal, but it's going to be all the time.
Okay.
And it could be, part of SIBO is just a continuum. It may start with yeast and just progress from there.
Okay. The other question I had about the MegaGuard is the amount of each of the nutrients that is in the product. Are those at higher levels than you would typically find on just a regular supplement that you would find like on Amazon or whatever?
Yes, I think when we've looked around on some of the other ingredients, because we're using the clinical amounts that were mentioned in the actual studies, you're going to see that they're higher.
Okay.
Because a lot of companies, unfortunately, will take a study, whatever the ingredient is, and say, well, our product has that ingredient, but it doesn't have the therapeutic dose because it's cheaper not to put the full amount in.
Okay. And what's the price point on the MegaGuard?
$36. So that's going to allow it to be part of the mix and match when you order, which is really helpful because at that 12, you get that 15% discount. So now, instead of ordering 4 MegaGuard or 4 Megaspore, 4 prebiotic, and 4 mucosa, you can order 3, 3, and 3 and include the MegaGuard and still get your 15% discount.
Okay.
Or any combination thereof. It doesn't have to be 3, but I just use that as an example. Okay, good questions. And I apologize for any of those that were on last week. I lost connection and we didn't get to do any of the protocol strategy. So if you have questions from last week you didn't get to answer just on the total gut restoration, please feel free.
Another question, is there a need to titer up on the MegaGuard, and can you take more than the recommended dose?
Yes, start with 1 capsule for a few days and then go up to the 2, just because that's always good protocol. If someone has any type of reaction, it's easier to go, down when you've on a half dose than on the full dose. So that's always the recommendation, titering, and don't add multiple products at the same time. Give them some time to see how it's going to work in their system, because you cannot predict people's sensitivities. People can be sensitive to anything. So give them a chance to really test it out before they increase the dose and before they add other products. And what was the second part?
Can you go up?
Can you add more?
Yeah.
Yeah. The recommendation is 2 a day. You can certainly go up to 4, but I wouldn't go any more than that, just because we are using the full therapeutic doses, and it could be irritating if it's too high.
Okay.
Yeah, some people, especially with gallbladder, say you have gallbladder stones, there's some products out there that are being recommended, 5 every hour, and that would be very dangerous with this product. So you don't want to, if someone has gallstones, slow is the answer, and very gradual, because you don't want to pass a stone and plug the bile duct, or that would be very serious.
Does the MegaGuard help with the bile stones or gallbladder stones?
It's going to help with flow. The gallstones, like kidney stones, like atherosclerosis, you're looking at a calcium issue. You're looking at that vitamin K2 product. And we've seen that help immensely with kidney stones. So, but again, start slow, help with their flow, help with the calcium deposition. And that would be, a good approach to work with them, but go slow. The body can adjust to a lot of things slowly, but it doesn't do well with fast.
All right.
Good questions. I'm gonna look for my water here. Okay. Yep. Drink all my water. Anything else? While we got a moment, people are thinking, many of you have been hearing about this conference in California, and I've talked to several of you wanted, and many of you given me good feedback too, that you can't go, and I understand it's a really busy time of year. Those who have not heard about it, it's their first attempt at having a real meeting of the minds in the world of microbiome. So they're bringing in the researchers that are doing the studies, and many of you have heard in Kieran's webinars, he's talking a lot about all these studies that we've got going. So they'll be bringing in the researcher on the dermatology, the dental, the GI, the OB-GYN, the heart, all of those things that we've been researching. They're going to explain the prelim results and kind of, announce it, live there. So it's going to be a real nerdy conference as far as science, but for those who are realizing that microbiome is the portal of health and really want to be gurus in microbiome, that's what it's focused on. So I hope that there will be some kind of recording of it. And if so, I'll be letting you know, just, make sure that I know that you're interested, and I'll put you on a list and get it to you.
I'm definitely interested in that, Tracy.
Any other questions? Super, super. Don't be shy. Let your voice be heard. No question is silly. And I just want to hear your voice and see your face too.
I have a quick question about the motility. As you and I talked earlier, and with the motility issues that I'm having, have you had good feedback on this product and getting people's motility moving?
It's too new.
Okay.
So, stay tuned. Let me know how you do with it. That's going to be probably the proof in the pudding right there is, get it in your hands and try it out. I too, I travel a lot, and you just have to mention, constipation, and I'll get constipated. So I'm going to be, trying the product out myself. So.
Yeah, that's also part of my challenges. I was traveling last week, and so it's, is it the prebiotic? Is it the travel and the, eating foreign foods and not being on schedule? And, there's so many factors that can come into play.
Exactly. Yeah. And, I think a lot of you know my story. I came up to Idaho to be an organic rancher, found out they're aerial spraying Roundup, and 8 out of 10 of my neighbors have cancer. And so this is really my motivation to figuring out microbiome and figuring out, all the products that work for it. But it also is a testimony to, we've got Roundup in the air, in the water, in the food. How much of that is affecting, our gut-brain connection, our, everything, constipation, emotions, anxiety. There is definitely something going on in the society. I've been in practice, over 30 years, and I go to trade shows now, and it's a lot of the practitioners that are suffering with gut issues, and they're trying to figure it out desperately because they have a practice filled with people with gut issues. So it's rampant right now, and so we really need to get a handle on it.
I was listening to a podcast this morning, like a webinar, YouTube, and there was a guy who's really into studying like GMOs and stuff like that, and he's been promoting like non-GMO diets and so forth, and he has seminars where he's in a room full of doctors, and he's been promoting going non-GMO and so forth, and the feedback that he's getting from these doctors when they tell their patients to go non-GMO is that it helps with all of the above, right? Everything that you just talked about. Yes. So I think we know the answer. I know myself. I had a Great Plains glyphosate test, and I was in the 100th percentile, which I was in just complete shock because I've been organic, non-GMO for a long time. So the fact that I'm holding on to glyphosate in my body it was shocking. And I was like, well, that's the issue with my gut, is that I'm full of glyphosate, plus the, I was on antibiotics like 2 to 3 times a year when I was a kid. So it's no wonder that from the age of 10, that my gut has just not functioned properly. And so I'm super excited to have found your products because I feel like I finally have hope that I can restore my gut.
Yes, absolutely. And you triggered a thought too. Part of the research that is going to be mentioned at this conference is because it's groundbreaking. No one has really studied what Roundup does to the microbiome. So we did in Ghent University, they have the gut models, which, these are very expensive, but we are led by research. You don't know what is going to work until you've done the research. So that's why we're really in the place we're in because of the research that we've done. So we had these gut models, a control, one with glyphosate and one with Roundup, and inoculated it with a pristine microbiome. And what we found after 3 weeks, glyphosate, was awful, but Roundup was 100 times worse. And it had all of the indicators of colorectal cancer after 3 weeks. So this is, again, this is going to be launched at that California meeting, but this is groundbreaking that there's actual evidence on what it's doing to people. And then the hope comes in with, then you inoculate the spores and find out that after 3 weeks, the indicators of disease have been stopped and then it starts to improve after that. So we can't stop the, you know, the loggers from spraying Roundup on the forests and the farmers from spraying Roundup 3 times on their crops. And we can't make these companies label GMOs, but we do have a product that can help once the damage is done to reverse it. And that's what's going to bring hope. And that's going to keep us hopefully healthy enough and sane enough to stop the politics that are allowing the other things to happen.
That's awesome. I'm so glad you guys are doing that. And I want to scream from the rooftops about your product, like I really do, because I feel like it is so critical to our health as a society. And so I'm super excited, and I've talked to everybody I can about it.
Well, I appreciate that, because you know this is going to be a grassroots effort that is going to get people involved, educated about microbiome, and then they realize, you know, what they need to do at the voting polls or in their own social media, and what the truth is, because the research is not getting out there, and really the research is being censored. So it's only through word of mouth and through the practitioners getting out there and doing public speaking to show this research and show people the truth. That's really our only hope for our future generations. And something else you mentioned, we are going to be doing an e-study or a module on GMOs that's going to be done by our scientific advisor. So know that we're getting very involved in the education process of the whole Roundup GMO issue.
That's awesome.
Super.
If you have the research studies, you know, once you have them, are you sending those out?
Yes. And, you know, some of our hands have been tied, because even though we've had some prelim results, the publishers have like a gag order on us that we can't put it out there, because then, you know, it affects their publications. So, yeah, once we get the go ahead, we'll be shouting it from the rooftops.
Awesome.
Okay, well, let's see. It's about 10:44. I think we'll go ahead and wrap up this recording so it won't be too long for people to check out. I will post it right here on this Microbiome University, and we'll get ready for the next one. I think will be on the vitamin K2 and how it helps with atherosclerosis, kidney stones, gallbladder stones, and even plaquing, you know, in the brain. So that'll be a great topic for next week. So hope to see you all then. Okay, take care. Thank you for coming and joining us.
Thank you,
Bye.
Bye.
Bye. Thank you.
Bye.